The London Clinical Summit really highlighted young people as an area where self-care needs to be both defined but also invested in. This project is looking to embed self-care within commissioning for young adults across London.
So there isn't a comprehensive self-care framework across at the moment. There are evidence reviews that show what works and what doesn't work. What there isn't is an overview of what self-care and self-management looks like, what works really well, and if we were to commission services for young adults, what do we need to have in place? So there's a gap there.
We decided we really wanted to define those self-care elements with young people themselves to actually test that it was relevant to the young people of London.
It's enabling young people to have the opportunity to drive this agenda rather than actually to be at the receiving end of this agenda.
We delivered 5 engagement events across London where we used existing organisations that were working with young people, so both schools, pharmacies, youth centres, and we worked with the young people they have to build up their skills and help us in partnership deliver these events. The first event was with Dunraven High School in South London, where we trained about 6 or 7 young people. They were given the skills that really helped to support and facilitate that event.
The engagement event today went brilliantly. They felt like their voices were heard, that their input was actually taken seriously. They understand as well that them being there changes the dynamics of the room, and it puts them on an equal footing.
I heard a lot of different types of people's opinions, like professionals, parents, teachers. It was interesting to see how they think so differently, and it was interesting to hear what they had to say.
And some of the themes that came from that event were around the importance of being able to categorise emotions for young people, because often they don't have the skills to be able to talk about things like fear, anger, trust. But once they do, then they're able to contain it and manage it, which really helps their self-care. From our event in Hillingdon, we really saw the power of peer networks and peer support in helping people to manage their condition, but manage it in partnership with others, like their friends and family, and how that can give them the confidence to look after themselves.
It's always good to find someone else to meet who knows what you're going through, who understands, who's done it themselves, and see the outcome for them.
At the event with young people from disadvantaged communities with KCB in King's Cross, the themes that came out really were around independence and them needing to have a safe space where they felt they belonged in the local community and could express themselves. We found there wasn't one uniform definition of self-care across the workshops. What self-care meant to some people was around just being able to be confident and supported, whereas for others it was to have support from their friends and family outside of clinical settings. So for young adults it means different things at different times. Another of our events were with a group of pharmacies in North East London that are working with communities to promote self-care.
We consulted around 1,000 people of North East London, and what they said was they wanted to be empowered to take charge of their own condition. So what we are now trying to do is to bring together the medical model and the social model and personalizing care at an individual level. We've got a number of pilot sites. One of them is offering a range of services which includes health coaching, public health services like smoking cessation and health checks. Now with the self-care program, we want to also engage young people using apps that enable them to have instant access to high quality, reliable information.
After all of our engagement events across London, we held a feedback event to allow the young people to contribute and enable them to have a first look at our draft report and make sure it reflected their views and experiences.
Looking back at the feedback, I've seen a lot of points that our groups and things like that made, so definitely being heard.
It's just really nice to talk to older people about this because it boosts my confidence up.
I feel like my voice was heard in the presentation and that my opinions were taken on board.
Some of the points that the young people picked up on were focused around language, and there were certain words that they found difficult to understand, such as signposting, guidance and partnership.
We learnt there was a difference between young people and old people in what the meaning of the word resources is. Because I think resources are what's on your budget, and you guys know that means books and internet.
We were able to redefine with the young adults a definition of self-care. Instead of it being what we thought, which was around the clinical aspects, it was a much more holistic view of looking after oneself. So based on that feedback, we developed the self-care wheel, which encompassed all the different aspects that we were hearing from the young people around what self-care is into one single model. From that, we found there needed to be greater emphasis of organisations like the Well Centre or youth centres, community centres, schools that are there to work together in partnership with health and social care, so that it's joined up around that young person. Increasingly, the management of health is happening outside of clinics. It's happening in the community and in school and where young adults interact with each other.
The Well Centre is a young people's health hub, which is a combination of having GPs here, such as myself, and we also have youth workers, and we also have a CAMS, a child and adolescent mental health nurse. We're attached to an existing youth and community centre, so it's already known as a community hub. The youth workers do wonderful work with young people around engagement, about helping support them at school if they're having difficulties, if they need to get back into education, around employment, around support around their families and bullying and all of those sorts of issues. Every young person that comes here gets a health check, so it's this kind of one-stop shop really, as much as we can. Obviously sometimes we do have to refer people out to more specialist services, but it's an open access, anyone can come as long as they're between 11 and 20. And local professionals refer into us as much as we get word of mouth. So local GPs refer in, school nurses, social services, people who run hostels and things. So we're here for anyone and everyone that has a need and needs to access the appropriate care and support.
What we need to realise is organisations like the Well Centre that are an amalgamation between a GP practice and a youth work charity are the future. They are bringing healthcare into the local community in a setting that's friendly to young people and that they're confident to access. When you give young people a voice and you allow them to express themselves in a way they feel comfortable, they will give you the answers to what they need to commission for them.